Imagine for a moment that every airplane in the United States was built by an individual, though highly trained, aviation engineer. Every plane would look completely different from every other plane, and there would be varying degrees of efficacy relative to safety and efficiency. Would you want to get on an airplane like that? I know I wouldn't. But isn't our healthcare industry analogous to that very situation? In our healthcare industry today, we have hundreds of thousands of independent physicians that are operating independently, where I would argue that we have as many different healthcare systems as we do physicians. We do have a body of information where we are built upon best practices and evidence-based care for virtually every specialty that exists today, but physicians' adherence to those principles of delivery is, for the most part, voluntary. So our system really needs to be built upon a system and organization that is built upon a foundation of established best practices and evidence-based care, married with an organized delivery system which encourages physicians, independent of financial rewards, independent of any other considerations, to be able to deliver care in accordance with those a priori best practices and evidence-based care. The result would be that we would go and have a consistent treatment process, diagnostic process, as well as a consistent therapeutic process that would provide much more consistency in what we do. Because frankly, if everyone followed that procedure and followed those protocol, would we really have a need for a second opinion ever? So let's focus on how we can build that system and how we can encourage physicians and provide them the tools and directions to provide consistent care in pursuit of clinical excellence.